Taking it out of the Pentagon, where defense officials are holding a briefing on the department's plan to distribute a COVID-19 vaccine nationwide. Let's listen.
Our deliberate and phased approach to distribute and administer this first allotment and future allocations of the COVID-19 vaccine will focus on vaccinating priority populations quickly and safely, while simultaneously refining the intricate planning for the delivery of larger volumes of vaccine in future waves. The department will prioritize DoD personnel to receive the vaccine based on the CDC guidance and on the department's own COVID task force assessment of unique mission requirements. The DoD prioritization plan is consistent with CDC guidance and prioritizes healthcare providers and support personnel, residents and staff of DoD long-term care facilities, other essential workers, and high-risk beneficiaries to receive the vaccine before other members of the healthy DoD population. As mentioned, the DoD plan calls for a phased approach. The initial phase is what we are calling a controlled pilot. In this phase, we will be distributing the vaccine to priority populations in 16 distinct locations. We will monitor the uptake and make adjustments to our plans going forward as necessary and as lessons learned from this controlled pilot. We will continue with this form of distribution, adding additional prioritized personnel in additional prioritized locations until 60% of our DoD, roughly 11 million personnel, have received the vaccine, at which time DoD anticipates vaccine manufacturing rates to support full-scale, unrestricted vaccine distribution to department personnel. At that point, our intent is to distribute the vaccine in the same manner the department conducts its annual influenza vaccine program. If you look at some of the slides we provided, the department selected initial vaccine distribution sites to best support several criteria. Number one, the anticipated unique supply chain requirements for the initially approved vaccines, a sizable local DoD population with priority personnel across all of the military services, and sufficient medical personnel to administer the vaccines and monitor recipients after initial and second dose administration. In his remarks, General Place will provide additional detail on those specific locations. In a recent virtual tabletop exercise led by Deputy Secretary of Defense and senior civilian and military leaders, the DoD COVID Task Force and the leaders responsible for the first phase of the plan walked through the processes in great detail to ensure seamless distribution and dissemination of this initial wave of vaccine across our selected sites. The lessons learned from this exercise help solidify the department's plan on the way forward. In terms of next steps, as soon as the FDA issues an emergency use authorization, DoD's allocation will be pre-positioned at our initial locations. Upon issuance of the EUA, the CDC's Advisory Committee on Immunization Practices will meet, review the EUA, and then vote to recommend the vaccine and how it should be disseminated and who should receive it. We expect to have shots in arms of DoD personnel within 20 to 48 hours from the time the ACIP issues its final recommendation. I want to personally thank the men and women across the department who have spent countless hours, both day and night, supporting the development of this plan. Their preparation for the vaccine of millions of individuals across the department in the coming weeks and months will protect our force against COVID-19 and allow us to continue to fulfill our mission to the nation. General Place and I look forward to answering your questions.
Good morning. Thank you, Honorable McCaffrey. Our country and our forces should be assured that the Department of Defense is ready to execute a global COVID vaccination plan for our service members as well as military families, retirees, and certain government civilian and contract staff. Following approval by the Food and Drug Administration and guidelines from the Centers for Disease Control and Prevention, the Defense Health Agency will lead a department-wide phased effort to distribute and administer the vaccine. While we await final approval from the FDA, the preliminary data on the safety and effectiveness of the two vaccine candidates is highly encouraging. We're recommending that everyone take the vaccine when it becomes available to protect yourselves, your families, your shipmates, your wingmen, your battle buddies, and your communities. As with most vaccines, some people may experience small adverse effects, arm soreness, fatigue, even a fever. The department will be fully transparent about any adverse effects that are reported and share this information with the CDC. Now, as Honorable McCaffrey mentioned, as we begin our vaccination process, the department specifically chose 16 locations, 13 in the United States and 3 abroad. We selected these locations based on our desire to validate our plan. As such, we chose locations with extra cold storage capability, sizable local populations to vaccinate, and medical staff large enough to administer it. We chose locations from each of the military services, including active and reserve components, along with the United States Coast Guard. Finally, we chose locations with an on-site immunization health specialist. As Mr. McCaffrey noted, the good news is that our military medical teams have worked for months to prepare for this moment, and we're eager to begin to deliver on Operation Warp Speed's promise. The Department of Defense has decades of experience with conducting global vaccine programs, whether it's the annual flu campaigns or protection against novel diseases around the world. We vaccinate millions of our service members and families and retirees of every age every year. And we have systems in place to monitor the health of everyone who receives a vaccine. In terms of the next steps, following FDA approval, the department will receive and begin vaccinations of our high-priority populations this month. We've identified the military installations and the military treatment facilities that will receive the initial shipments of the approved vaccines, as Mr. McCaffrey noted. We have initiated our staff training protocols for vaccine administration and working closely with our TRICARE network providers and pharmacies to prepare for wider scale vaccinations as the vaccine supply expands. This phased approach to vaccination will take time. We recommend that everyone continue to follow the latest CDC guidelines to include physical distancing, hand washing, and wearing face coverings where appropriate. This has been a challenging year for all Americans, and I'm inspired by the perseverance and commitment of the men and women of the department and the military health system. Together, we're working as a team to protect all entrusted to our care. Thank you.